We're here.
You're here,
Yeah,
Louise,
we're back.
Jeremy. Welcome back.
Back at it.
Yeah, we're back at it. So for all of the new listeners and for all of the ones that actually bothered to actually knock on our door and click on that button, welcome back. Welcome back to the Health Intelligence Pitch podcast. As they always say, come for the insight, stay for the chat. So
right.
This is where we're here. For those that don't remember or is their very first time listening to this, we are literally here to actually have unscripted conversations with two executives in the healthcare sector who represent their hospital systems from a supply chain perspective. But this is more around their thinking, not necessarily around their organization. So welcome back, guys.
Thank you, man.
Thank you.
Happy to
Look
be
forward
here.
to it.
I am. So, we set this up really to, create the space of opportunity where we're going to discuss, the topics of today. And last month was what it was, and this month is obviously extremely different. So today's episode, and once again, you guys have no idea what this is about.
No.
Does the corn, the onions, and the potatoes, and the pumpkin give you a bit of a clue?
Not
Harvest.
really. Harvest. Is it Thanksgiving vibe we're going for? I'm not sure.
Harvesting savings.
Oh, wow.
Wow, well, I
That was
never
a
thought
little
about that, but that could be it. No. So today's our first episode. What we're going to do is going to spend about 14 minutes with both of you here, and then we're going to go back to the rugby sevens format, where one person is going to go into the other room. I'm going to be asking you the same question, but obviously we're going to get completely different replies like we did last time.
Okay.
And I thought from a format perspective, it really came through really positive.
Yeah.
In other words, you guys don't really think alike.
At
all.
I didn't know that.
I didn't know that either.
So the topic today is that we're looking at how health systems are adapting their operations with the OBBBA, okay? With the and one thing that we're actually not touching on, this is not a political discussion, and it's not anything to do about what that actually means from a legislation perspective, but more around what is the thinking that you've actually got to do to actually pivot around and your business, because literally it's changing every month to every week to every day that something comes out. Let's face it, if we were health insurance people today, the decision that we made yesterday versus a 20 to 30% decrease in your stock, the decisions that you'll be making right at this very point would be very, very different, right? So for us, it's really, as supply chain leaders, what is it going to be like? Now, one of the first things I just wanted to draw to your attention, just to actually give you a little bit of a level set, when we look at the industry context of what the One Big Beautiful Bill is actually looking at, the numbers are straight out of the Premier Source document December 25, so it's nothing that we're making up. But 1 trillion federal spending cut in the upcoming decade, close to 69 billion estimated national hospital revenue impact in the next 2 years, and the estimated average impact per hospital in the next 2 years is about 16.1 million. However, when I look at Delaware and Illinois, when you actually think about your regions where Luis, you represent Christiana Care in Delaware, the impact that we see is around about $7.6 million per hospital. There's 19 hospitals with an impact of 145 million in that state. Jeremy, Illinois, wow, 235 hospitals. The impact is 7.8. Impact is about 1.842 billion.
Oh.
Now, you obviously know how many hospitals you have, so then you just have to try and multiply that number and then start to think about it. Why I found this quite an interesting conversation, I was literally in New York and visiting a hospital system. And the first part of the discussion was, I've got to find 100 million. That's what it came out for me. And the big thing about that 100 million, was 40% of that is allocated to the supply chain head. And I don't know, you can declare whatever, your percentages, from that perspective, but that's a big number, and that's a big responsibility. And he only had less than a handful of people to actually manage it. Okay, so the general questions that I want to try and tease out for both of you, and we'll just spend some time just thinking about this. Do your conversations shift more towards protection, prioritization, or redesign when something like this is actually, let's say, hitting the floor, through your discussions? And I don't know if you want to speak, was there something that actually just popped up, and then, you've gone into scenario planning, overdrive?
Can you keep protection,
Yeah,
redesign, and what was the second?
Prioritization.
And what do you mean by protection?
Are you conservative with regards to, making sure that whatever you're actually projecting out there is going to be palatable to your community, to your staff? Let's say that could be one form of it. Prioritization is another view with regards to, well, what are you going to be putting forward with regards to your initiatives? Have they changed? Have they shifted?
I think I can go first.
Yeah, go ahead.
I think we've done a lot of work with protection, I think, already. It doesn't mean that there's still not opportunity, but I think my mind goes to redesign. I think that if we're going to continue to dig deeper on savings and cost efficiency, it's probably rethinking about how we approach it. I think we touched on it at the last podcast. I think we do okay with tangible goods. I know there's always more opportunity, but I think there's a lot of other spend categories where we probably aren't as informed, or where we're not as informed. Purchase services, IT, et cetera, indirect. So I think how we manage that work, there's probably some good redesign there.
Has that been a big shift because of, let's say, what's been happening? It's like all the plans that were in situ, through your business planning process, let's say 6 months ago, and now all of a sudden, we've known that this has actually come through, but, has the impact changed the way that you guys are operating?
It should. I don't think it's gotten there yet. I think so redesign is where I personally think we need to go. I think that our traditional savings methods are still going to help us. We're going to do okay with this, but we got to dig deeper. So my brain goes to redesign, but I think we're just touching on that.
Okay.
So personally at Christiana.
Yeah, and I would a little bit of all three. But I think the protection, I don't see, like, when I think of protecting, like getting accurate numbers out.
Yeah.
I have actually been working, and this is part of even like the redesign concept, is working with my executives and my leadership to be like, I'm going to project out, this is the number I think we can get to, but it isn't me doing it, it's us doing it. So if we don't hit it, it's because we didn't do it. It's not supply chain, because a lot of these things take effort from all parties. And it's really prioritization is really leads into that, like, and it is prioritizing things like purchase services more than tangible goods, right? Like goods we can still do things, but there's all the tariff activity, all that going on, which you can still impact, and you still need to work on. But it doesn't really pull a ton of money out of the organization, like where it stays out. You can purchase services, you can do things like, do we need those activities?
Why is that? Because it's all of a sudden in the need of the hour, because it's something,
like
it's a difficult category to attack.
Yes, and that I would agree with you. So it's a difficult category to attack, but recategorizing all of that, making sure all of it for all of your different executives, your facilities guy knows what his is, your marketing team knows what their expend is and what they're spending money on and what that means in categories that make sense for them.
Yep.
What your IT department does as well, right? And then the prioritization goes into, and actually this is some of the redesign we're working on. How do we think about those things and what do we really need and what's bringing value, right? So if it's not bringing, it could be fantastic, like it's great, but it's like, we expected to deliver this value 3 years ago and it's not.
Yeah.
Is it something that we need to do? Because we need to be thinking about, like, almost like we do capital.
Yeah.
We have this much money. We need to make sure we're spending on the things that actually make a difference and actually push that margin forward.
Right.
Because purchase services, all these things aren't just save money, that can help generate revenue if they're impacting the right spots. So thinking about it, trying to shift that dynamic thinking into how do we assess these things on ROI, return, not just like, oh, it's nice to have some extra help, right? And if that's all it is, and we can do by, and you already have people that should be doing that, do you have the right people doing that, and like those types of discussions? That's how we're just starting that. That's I mean, to your point, this dynamic is actually leading to us have those kind of discussions with our leadership.
Yeah.
I mean, we've just had years of experience with negotiating implants. Like, again, there's always opportunity, but we got good benchmarking data. I think physicians generally don't like waste. They're trying to do the best, well, for what they believe is necessary for their patients. Same thing with nursing. But what we're not great at is all the different services we buy, consulting engagements, outsourcing arrangements. Are we really doing that efficiently?
Is it coming together from a collective view? Because, you know, like you say, the physicians, et cetera, recognize that there is this big pressure on the hospital systems. If, for example, this New York hospital that I was talking to, if it doesn't happen, then, you know, the number of rural hospitals that's going to be closing down, or the number of hospitals that are under margin pressure today, I don't know what the, let's say, opportunity is for them to, let's say, continue to serve the patients, you know, in their community. It's obviously that grave from that perspective.
Yeah, there's a lot of hospitals already underwater, and this is just making it that much harder.
I suppose my question is more of a case of that is now everyone saying, hey, we better come together, and under these new constraints, we've got to think a little bit differently, as opposed to you staying, you know, in your guardrails.
I think it's going well with physicians, honestly. I think you're always going to have a few pockets, but I think physicians are very well informed on insurance policies, reimbursement. You know, if we're going to pay more, is it really worth it? Is the outcome, does the outcome match the expense? I think that if you can have honest conversations, if they didn't know, you can have honest conversations around it. I think there is a collective around lowering the cost of care. I do. I think it doesn't mean the conversations aren't challenging, but I think people are receptive.
Yeah.
I agree. I think that mindset's changed because all the challenges in the industry are creating that. I do think they're actively, it used to be you had to work with them. They're actively coming out and be like, I want to talk about it. I do think a lot of it's about data though. Like how, it's not just this implant costs more. It's like my total cost of procedure costs this, and here's the makeup of this, and let's talk about those variability. But then in the purchase services role, it's the same kind of thing. It's CIO, we're spending money in these different categories within software, within hardware, within consulting to support these things. Where's the payoff, and do we need all those things? Marketing, this is what you're learning. What's adding value? What's the nice to haves, right?
So are different decisions being made now with regards to that? Because
it's starting to happen because I would say we're on their path to different decisions being made. But it's because it's the first time we're starting to look at it this way, with that kind of pressure.
I think now, honestly, I think those conversations are more difficult. I think talking to a clinician or a physician about expense management is easier now than speaking to other leaders about expense management and value. I think for a long time it's just been out of the wheelhouse. It's an assumed sunk cost. We've been paying for this for a long time. I think those can be more challenging than talking to physicians about total cost of care.
Yeah. But, you know, in your environments today, is there a lot of discussion about these are the headlines? If we don't do this, then the consequences are this. So that's more talking about protectionism around the realities of a business decision.
If we, the whole, does people get the ramifications of this yet? Like, I would say that's still sinking in. There's still the assumption we'll always pull, at least my organization will be able to pull through and figure it out. But I think it's starting to create some real dialogue over, because some of this to get out of this isn't just saving money. It's where do we invest our dollars to generate the revenue or bring return, and that's that prioritization question. How do you reprioritize those things to not? Sometimes that might not be the big money savings thing, but the energy needs to be put there because that's going to bring overall value. It's more often greater than saving a few dollars over here. So it's starting to look at the world a little bit more through that lens than we historically have. Like that, I see that starting to happen.
Yeah, I would echo that. I think, I've been doing healthcare for 20 years now, and I feel like there's always something going on in healthcare where there's a cost constraint, right? Something creating some sort of pressure to reduce costs, and I think overall it's helping. So yeah, I don't sense a new urgency. I think our finance leaders probably feel it more than everybody else. But I do think it just allows a conversation to be had.
Yeah.
But I'm not sensing that everyone's really freaking out yet. Yeah.
It's interesting that you say that, though, right? That your finance leaders are probably the ones that are feeling the pressure.
Yeah.
When the reality is, everyone should be feeling
Which
the
is-
pressure.
right.
From this. They're the ones that are collecting the beans and counting the beans. Are not necessarily the ones that are generating the beans.
But to be fair, like, I would say the counter argument to that could be these conversations are real, that healthcare is changing now. So the providers probably know something is going to happen, but providers can also go create their own outpatient center now. So for what they want to do, they may not necessarily rely as heavily on the hospital.
Yep.
So and that's something that's like more available now than ever. So
Well,
there's
yeah. I think you touched on something, Liz, that finance partners are, I think that they're feeling pressure, but for a slightly different reason. Not just they see it, but the way we used to analyze and how we use our GLs and our accounts to like generate the data to make informed decisions isn't up to par to the ability to categorize our spend in ways that are meaningful to different populations to make more informed decisions on how I spend money to return value. Those aren't necessarily aligned. The categorization's never been thought through. Like the standard accounting playbook doesn't lend itself currently to that.
Yeah.
So, and it's starting to create that challenge. People are like, I need that information to make better decisions, and they're struggling to deliver, and they're feeling that pressure.
we were chatting about that.
I know, and that's why I'm laughing. Is tell the audience a little bit about.
I thought these were questions we're not supposed to know about in
No,
advance.
we're just chatting.
Yeah.
We're just chatting.
Just a
We
chat.
weren't actually.
Just kidding.
I wasn't giving a bit of a leaking.
No. So this is actually like very, I'm going to borrow your word, serendipitous, right? So yesterday I was talking to a CFO from New Zealand who's going through, again, healthcare is, the problems are universal. The national healthcare system has disparate systems. They've consolidated, so different ERPs, how do we leverage our data, et cetera. So that led to a conversation around, before you consolidate ERPs, you could do a lot with just clean data. So bring all the data, categorize it, and you can still act on it before you go to a new ERP. And never is down there with the CFO. But the CFO said something that you and I used to talk about. That's what prompted this conversation is, because he was meeting with different ERP vendors about potentially moving to one ERP. But he said something that I loved when he said this. He said, well, Louis, I don't know if I need an ERP now because with AI and the way it's moving, ERPs may become somewhat obsolete. And I said, yeah, that's a real potential. And that led to our conversation about categorization and how much do you need management accountants categorizing spend. If you have clean data and Hunter can categorize it, tell you exactly what you're buying, then you don't need people allocating it anymore, right?
Yeah.
It's done for you, right?
And isn't that interesting though? Because it's
But I think it
somewhat
needs to be
the
done
power
in ways that's meaningful to each of the audiences too. Like
100%.
for that segment of your business, right? Your marketing exec needs to have.
Yeah.
It needs to be categorized that make sense to them and how they make decisions and inform. But
Yeah.
I agree with that concept. Like that's.
Yeah, but in some ways, right, we're talking that the mechanisms of traditional, let's say, data gathering and who's responsible for it is somewhat, with AI, the power can be
Yes,
shifting. Because
100%.
ultimately, you guys are the ones that are, once the beans are counted, you're actually looking at everything that's coming through the door. And how it's actually categorized brings power to management accounting. So if you can break down IT down to the grassroots level, you can then come up and say, well, I don't want to have a broad categorization of software. How much software did I spend in financial systems? Okay, I can tell you, right? Just like that.
Yep.
Okay. So the power in some ways.
And that data is maintained cleanly because that's the other thing that people will do that one time. And then they'll always be months behind getting it all in the right buckets.
Well,
But AI can do that very quickly.
Yep.
Today we know GLs art can be wrong because if a human made an error on a PO, how it was ordered, categorizing correctly. Now now it's kind of irrelevant now. Your budget's off because of a human keystroke error, right? So if you have a clean default to where what the categories actually are, that's real.
Yep.
You don't need intervention at that point.
Yeah, and you know, the sad thing is, right, you know, your management accounting is only as good as, let's say, your budget for management accountants. Because, you know, if your chart of accounts is 300 labels versus, let's say, 1,000 labels, then, you know, 1,000 labels allows you to go down to a level of granularity to manage your budget. But if you only have 3 management accountants, and you've only got, let's say,
And
200.
the accuracy is not there.
The accuracy is just not there.
Yeah, it doesn't matter.
Now, we could probably spend a whole lot more time on this, but I just wanted to just give you the view that this is the sort of thing that I want us to focus on in the next few sessions, because hopefully it's giving the audience a bit of a grounding of these are the problems that are actually in front of us today. You've given us a perspective that people are thinking about it, are starting to actually react about it, and then we'll go into, let's say, more of the detail of what does supply chain actually do in these situations. Sound good?
Yeah,
Yeah.
Okay, done.
great.
All right.
One of you going to shift off into the other room?
You want to go first this time?
Sure.
Okay.